Most of us think of hospitals and doctors' offices as places we can go to get help and be safe and cared for. However, increasingly, the workers there are not safe.
The WRAL Investigates team found violence against healthcare workers is up, with charges for assaulting emergency personnel skyrocketing. This is contributing to a dire shortage of healthcare professionals.
WRAL Investigates Sarah Kruger is back now, this time to examine the growing problem and possible solutions.
We've worked on this story from a lot of different angles. First, we crunched the numbers from court records. Felony assaults on emergency personnel in North Carolina are up 145% over the last decade. We talked to a doctor who lived that and is still suffering from his injuries, and the people who are focused on solutions. This hospital in Greenville is where Dr. Charles Brown worked in emergency medicine more than 2 decades. Just months away from retiring, he let his guard down.
I was complacent and I got careless and paid the price.
The price, a punch from an angry patient that left him unconscious. His eye socket broken in 3 places, his nose broken too. Plates and screws still hold his face together after reconstructive surgery. He has a vision defect that's permanent.
If I look up, I'll see double. So if I look into a lower cabinet under the counter, I'll see 2 sets of pots and pans kind of thing.
Court data shows charges for felony assault on emergency personnel up 145% in the last 10 years in our state. Looking specifically at nurses, National Nurses United found 8 in 10 experienced violence in the last year.
Do you think the average person knows how dangerous it is to work in a hospital?
I don't think the general public has any idea.
Inspired in part by what happened to Dr. Brown, Dr. Timothy Reeder, Brown's former medical partner and now state rep, took action, sponsoring a bill that's now law and goes into effect next year.
It's called the Hospital Violence Protection Act.
It will require hospitals to have a law enforcement officer on site and to keep track of assaults and their outcomes in court.
When you're worried about your safety, when you're never sure what's going to happen to you, you can't be dedicated to the patients that you're seeing, the family members.
This issue is important because it contributes to recruitment, retention, well-being.
You were telling me that, you feel a little short of breath.
At UNC School of Nursing, they're working on another solution, enhanced training made possible by grant funding. Instead of learning how to respond to violence through a computer course, nurses and nursing students will get a more realistic experience.
We're going to use actors, trained actors, to play the role of patients, family members, and other healthcare providers.
For Dr. Brown, all these steps are good ones. He hopes to see continued resolve across the board to stop the violence.
I think it should be a high priority. I think it should be higher than it is.
Repeatedly, we see that internal surveys from healthcare groups show violence is causing people to leave the profession. The National Center for Health Workforce Analysis says over the next 15 years, we can expect a shortage of 139,000 doctors and 337,000 registered nurses. With all the training needed for those professions, time is of the essence to turn that around. Sarah Kruger, WRAL News.